of Southeast Asian nation, also known as ASEAN, is home to 618 million people, a population size 1.5 times larger than that of the European Union. The region is the fifth largest economy in the world and has undergone significant demographic and economic transformation over the past few decades. Along with socio-economic changes, the epidemiological landscape has also shifted remarkably. Understanding the disease patterns and burdens in this region can help inform policy changes and to address existing and emerging public health challenges. Similar to global trends, the epidemiological profiles in most ASEAN countries has shifted over the years from infectious diseases to non-communicable diseases. Cardiovascular disease is the leading cause of death and disability in ASEAN. In 2021, there were an estimated 36.8 million prevalent cases of cardiovascular diseases and 1.7 million people die from it. Understanding the magnitude of the prevalence and disease burden of cardiovascular disease is crucial for identifying care gaps and resource planning. The map shows the distribution of age-standardized prevalence rate on the left panel, mortality rate in the center, and disability-adjusted life year on the right panel, across the 10 ASEAN countries. Red color indicates higher rate and blue indicates lower rate. As shown in the graphs, there are considerable geographical disparities in the region in terms of prevalence, mortality, and DALY. Regarding prevalence, Malaysia has the highest prevalence of cardiovascular disease in ASEAN, while Laos observed the highest mortality and DALY rates in the region. One of the key findings in our research is that cardiovascular mortality is very high in the ASEAN region. In many countries, mortality rates exceed the global average. The time trends here illustrate the changes in cardiovascular diseases prevalence, mortality, and DALY over time among ASEAN countries compared with the global average. The color line represents country-level value, while the dotted line reflects the global average. There is huge disparity in cardiovascular disease mortality across the region, with more people dying from the disease in Laos and Indonesia compared to Singapore, for example. The age-standardized mortality rate in Laos and Indonesia were about 400 per 100,000, which is more than 5 times higher than the mortality rate in Singapore, which is estimated as 76 per 100,000. This signals a gap in access to life-saving intervention and care. The high cardiovascular disease mortality rate indicate a need to improve surgical capacity and enhance access to life-saving interventions. However, beyond that, the more cost-effective approach is to focus on risk reduction through primary and secondary prevention. For example, smoking continued to be a major public health issue in several ASEAN countries. Stepping up tobacco control and reducing tobacco consumption can substantially lower population health burden of cardiovascular diseases. In addition, there's a continuous rise in obesity in this region, where prevalence in some countries have quadrupled over the years. Addressing overweight and obesity will be vital to CVD prevention. While many policy changes require local and national governments' effort, ASEAN as a regional cooperative network can play a crucial role in fostering a favorable macro policy environment that support national public health strategies.